Our next speaker is Michelle Lincoln, who's the Executive Dean of the Faculty of Health at the University of Canberra. She's had many roles, and some of us may remember when Michelle was at the University of Sydney and had a good association with us at Poche, Sydney. She's done a ton of things in the allied health area, and particularly around allied health, nursing, midwifery, public health and sports workforce, which she's had to really pick up at UC in what she's doing. Published more than 130 peer-reviewed journal papers and clinical placements and so forth. She's won the University and National Teaching Awards for education expertise in speech pathology, a very important area, and she's been a fellow, and she is a fellow of Speech Pathology Australia and a principal fellow of the Higher Education Academy, and currently is located within the University of Canberra Hospital. So, Michelle, welcome.
Thanks, Tom. My thanks to the Poche Network, Poche Sydney for the organisation of today, and the Poche family for their support of everything that goes on within the network. I'd like to acknowledge the Ngunnawal people, the traditional custodians of the land that I am very lucky to live and work on now. And I pay my respects to elders past, present and emerging. My job today is to talk about growing the Aboriginal and Torres Strait Islander allied health workforce, and I feel like I've been beautifully set up by the previous speakers who've given us lots of hints about the kinds of things that we could be doing. I think, though, the best thing to do to start off with, though, is to set the scene a little bit about participation of Aboriginal and Torres Strait Islander people in higher education in general. So in the past decade, the number of Aboriginal and Torres Strait Islanders at university has doubled. And we know that around about 22% of those students have been enrolled in health degrees. So that's across medicine, nursing, allied health, dentistry, the works. And while that sounds great, in reality, the National Allied Health workforce is very small, and Nikki talked a bit about this. It's about at 1.8% of the workforce nationally. What that means is that in Australia, 0.5% of physiotherapists are Aboriginal and Torres Strait Islanders. And if you take it more locally, in New South Wales, in the public health services, there's one Aboriginal podiatrist, 4 Aboriginal speech pathologists, and no exercise physiologists. What that means is when Aboriginal and Torres Strait Islander people come into our health systems, they don't meet other Aboriginal and Torres Strait Islander people if they're looking for allied health services. And we know allied health services are really important, particularly in prevention of chronic disease, in mental health, as Pat has talked about, in keeping people out of hospital and participating in their lives to the best that they possibly can. So we need to grow this workforce, there's no doubt about that. Culturally competent healthcare is associated with improved healthcare outcomes for Aboriginal people. We know that. We also know that educational attainment is a social determinant of health, and educating people about health, it has a double impact really, because they know about health, how to be healthy themselves, how to help with their family and their communities to be healthy, but also to intervene in a much wider way. And I would argue that in allied health at least, we're not looking for parity. We're not looking for 3% of our workforce to be Aboriginal and Torres Strait Islanders. We need more than that. If we're going to close the gap, we need it to be way more than that for parity. So there's a lot of work that we need to do. A little bit about students. Aboriginal and Torres Strait Islander students coming into university tend to be older, so in the 25 to 64 years range, and in fact further up, more like 40 and over. More women than men, Aboriginal women and men come into higher education degrees. In fact, it's 68%, which is great, but it's also a worry. Where are Aboriginal men in the education system? We know that Aboriginal and Torres Strait Islander students may take longer to graduate, and they in fact are less likely to graduate. So the completion rate at 9 years post starting a degree is 47% for Aboriginal and Torres Strait Islander people, compared to 74% for the rest of people who start a university degree. So that's not a good statistic, and that tells us that something in the system is not working. The flip side of that is that when Aboriginal and Torres Strait Islander people graduate from degrees, they have higher employment rates than other graduates, and they earn more post-graduation than other graduates. And so again, this is an ongoing contribution to changing those social determinants of health. So I'm going to talk a little bit about engagement and recruitment of Aboriginal and Torres Strait Islander students into health courses. And I've distilled this information from Universities Australia report published in 2017. A whole lot of grey literature across the sector which reports on specific programs that individual universities run in this space. And I could actually cut my presentation really short here into 1 or 2 more seconds and say to you, what we actually need to do here is to listen to IHA, to listen to IHA and their members, because they're the people who know what will bring students into health degrees. But given that Tom's given me a bit more time, I'll say a bit more than that. So the first 4 points there, outreach programs, campus experiences, engagement with elders and communities and family visits, are about creating a sense for Aboriginal and Torres Strait Islander people that they have a place at university. They have a right to be there, they belong there, they can be successful there, and their culture will be acknowledged and celebrated. And so there are lots of different ways that universities go about doing that. At the University of Canberra, we have an elder in residence, Auntie Rosalind Brown, who provides our students with pastoral care and guidance, both on their way into the university and while they're there. We also have engagement with the United Ngunnawal Elders Council in the ACT, who also contribute to university policy development and hold us accountable for the work that we do with people in our university. Someone in the audience gave an example of an outreach program where university activities are taken into communities for young children in primary school so that they start to see a way forward for themselves into university. And similarly, bringing young people on campus as part of school experience to understand that university is not scary, there's heaps of ordinary people there, people like them, and that this is a place where they can be. At the University of Canberra, we're interested in engaging people through sport. We have a strong sporting presence, lovely sporting facilities, and bringing kids from school on campus via sport is a way of engaging them in the space. The other strategies that follow on under that are really about finding pathways into university for people who may be older or didn't do their HSC, for example, and finding ways that will make that journey into a university as easy as we possibly can make it. So support for application, the application process. Universities are well known for being complicated with administrative processes that are neither easy nor friendly. And so having support through the application process can just take some of those barriers away. Articulation and arrangements, and we were talking about this before about qualifications through the vocational education. So universities do take the marks, grades and completions of vet sector qualifications as a replacement for ATARs in order to allow students to enter into university allied health programs. Interestingly, for nursing, for example, you can do an assistance in nursing, certificate 4, veterinary vocational qualification, and get credit for the first year of nursing at UC in a 3-year program. That doesn't work so well in allied health, and I think we need to work at this a bit, because there's one vocational 4 qualification in allied health for entry into, how many did you have, Nikki? 40 odd allied health degrees. And so it's not as easy to give credit and to recognise that prior learning. We can certainly take the marks and grades and the completion as a sign that this person has the potential to succeed at university, but the credit arrangements are not quite as neat as we see in things like nursing, for example. Universities will have various pathways that will bring people into university through non-traditional means, and all universities have those, I would imagine. Universities generally also have enabling courses where students in their first year take a mixture of first year units in their degree and then enabling subjects, which might be around academic writing, for example, that catches students up and supports them to develop some of the skills they might need to be really successful. So two kinds of buckets of things around engaging and recruiting students. One around creating a sense of belonging and a place where people can be, and the second one about finding your way into the system and being successful. I did want to just talk about a little bit about research. There's some lovely work that's been done by Royanne West, who identified 5 factors that promoted the success of nursing students. Kylie Gwynn from Poche Centre Sydney took that work and replicated and extended it with people doing Certificate 4 in Allied Health Assistant and in Dental Assistant, like Paul spoke about this morning. That program that Paul comes through has an extraordinary success rate. It has a completion rate of 96.8% compared to 29% in the rest of the sector. And it's because they use these enabling factors deliberately in the way that they have structured and delivered that program. And I think there's a lot for universities to learn from this. So I'm going to quickly talk about each of the factors. So the first one is about students' characteristics, and this is really about ensuring the students coming in have the motivation, the resources and the prior life experience to be able to succeed at university. I'm not talking about marks or grades actually. A lot of those are both family, personal and community characteristics. Having teachers with an understanding and awareness of Aboriginal and Torres Strait Islander culture and who are able to weave that into their learning activities. So having people who can talk about Indigenous knowledge, who can talk about, particularly in health, Indigenous perspectives on health and wellbeing. Weaving that into the curriculum creates a space for students to have conversations about that, and taking a strengths-based approach to Indigenous health in terms of Aboriginal people's connections to family and country and their sense of wellbeing. So that, having that embedded in the curriculum is an enabling success for Aboriginal students to finish their degrees. Relationships, connections and partnerships are about helping Aboriginal and Torres Strait Islander students to establish those relationships with other Aboriginal and Torres Strait Islander people in the university, so other students and staff, and that was a really important enabling factor. And the final one from Royanne was about family and community knowledge, awareness and understanding, so that people succeed at university if they have the support of their family and their community. Paul's nodding. Particularly when you think about the demographic I showed before, that these are often older women, and so community support in terms of childcare, for example, can be really critical to success. In Kylie's research, the 2 other enabling factors she found, one was about employer support, because most of the people in the Allied Health Assistant, Dental Assistants training were in jobs, and so they needed time release from their employers to be able to go and do the intensive courses. And without that, people need to be earning an income while they're studying, and so that was a really critical factor for success. And the last one was about listening and improving, that people running the scholarships program listened to the participants and were continually working to improve it as an education and learning experience for the people involved in it. So I think there's some really useful information in those factors about what we need to do to help our students, our Aboriginal and Torres Strait Islander students, to be successful at university. Going back to the Universities Australia's support report, there are a few other things that most universities will do. Most will have dedicated support units. At Canberra Uni we have the Ngunnawal Centre that provides pastoral care for our Aboriginal and Torres Strait Islander students, but also academic support. Cultural responsiveness training for staff and students, so that the classroom is a safe place for Aboriginal and Torres Strait Islander students to be. I think engagement with Indigenous. Allied Health Australia is absolutely important for student success, particularly the mentoring program, meeting other students, knowing that there is a career path ahead for them. I think one of our challenges is creating opportunities for Aboriginal and Torres Strait Islander students to come together in health. So I've called that cohort opportunities. At Canberra, we have 90 Aboriginal and Torres Strait Islander students enrolled in health. The majority of those are in nursing. The next biggest group are in psychology, and the third biggest group are in exercise and sports science. And then we have 1 or 2 students in a whole lot of other degrees, like physiotherapy, occupational therapy, medical radiation sciences, optometry. So those students are very much on their own. And so we want to bring them together as a group across the whole faculty so that they can know each other, support each other, socialise, have fun together, feel comfortable and relaxed with each other. And I think as we get better at recruiting Aboriginal and Torres Strait Islander students into health courses, we'll have even more opportunities for creating those cohort opportunities. Scholarships and accommodation in particular are important in terms of success, the availability of those. And from my experience, having Aboriginal and Torres Strait Islander health academic workforce is also really important. So having role models in the university of Aboriginal and Torres Strait Islander people who have done health degrees, who've done PhDs, who are now doing research in their communities and teaching about Indigenous health is a really important success factor for all of those other students who will come through after them. Of course, that's a massive challenge. My colleagues from universities that are here, recruiting in that space is often difficult, and Aboriginal and Torres Strait Islander academics in health are sought after across the sector. And that's a great thing for those few people, but we need more of them. So we need to do more. The statistics are not great. I think that they're improving, but they're not great, and we're not going to get anywhere near the level that we need to be unless we start to do some things differently. So I think that we need to take and support the leadership that Indigenous Allied Health Australia is showing. We're really excited that the Academy is going to be running in Canberra, and we see that as an enormous opportunity to work with IHA, to talk with children in Year 7, and to get them excited about health careers and thinking and dreaming about what could be in their future. I think we really need to think about the cohorting idea, and is it possible that we could have Aboriginal and Torres Strait Islander tutorial groups within units or even courses? One of the successes of the Poche scholarship program is that the dental assistance and the allied health assistance courses are for Aboriginal students only. And in the research that we've done on that, that's been a really important factor in the success. And so I think we need to think about how we could do that in a university context. I do think it's important that students have the opportunity to talk with other Aboriginal and Torres Strait Islander students around what it's like to be working in your own community as an Aboriginal person, what it's like to work in another community as an Aboriginal person, what it's like to be working with family members in your community. These are the kinds of things that are different perhaps for Aboriginal and Torres Strait Islander health practitioners that don't get talked about in class, that don't get talked about in wider health degrees, and so we have to create those opportunities for our students going forward. I think we need to get a whole lot more flexible about how we deliver our allied health degrees, because not everybody can pick up and move to a centre where there's a university. At UC, we have just had accredited a speech pathology degree that is delivered in distance mode. And it's delivered with the students online in their own communities, at home for most of the time. They come into Canberra for short, intensive periods each semester. And about 50% of the students in that degree are in regional and remote Australia, and about 50% are in Canberra. And I think we could be thinking about doing this with other allied health degrees. I think it just opens up accessibility to a university education to a whole range of people who, for whatever reason, need to be in their community. The final point I wanted to make was I think we need to think more about clinical placements for our Aboriginal and Torres Strait Islander students. And this is not my idea, this has come directly from IHA. When Donna was at the University of Canberra not long ago doing a workshop with us, she challenged us by saying, when you send your Aboriginal and Torres Strait Islander students on placement, do you check if the organisation has a reconciliation action plan? Do you check if the supervisor has had cultural responsiveness training? So these were hard questions, but we intend to... Oh, maybe that means my time is up. But we intend to follow up on them because it is really important that when we take people into our degrees, we can ensure that they're going to be safe when they go on their clinical placements. And so I'm going to leave you with that thought and hand it.
Thank you, Michelle. And I think, one of the important things about allied health is that it's anything from a TAFE qualification through to a high degree, and so there's a range that we've got there, and I think part of the discussion was about articulation arrangements, and what UC does with CIT and some of their courses, I think a good arrangement with the TAFE provider, but also there was a program with the Indigenous Marathon graduates. Did you want to talk about that?
Well, it was a bit before my time, but I do know. So it was a partnership about bringing people who were participating in the Indigenous Marathon program into university and training on the campus as a way of helping them feel like they belong there and could have a future there. You probably know more about it than I do, Tom.
A little, yeah. And it was before his time.
Tom.
No, but it was about recognising that, that they wouldn't get full RPL, but they would get supported to be able to upgrade their qualifications into a lot of the sports sciences areas and into sports management, which is a critical element. And as Nikki said before, well, I said about her and her interest in lifestyle arrangements and keeping active and fit is really another area that we have to look at. Yeah. So, any questions, comments on Michelle? Nikki?
You might be able to answer it, Nikki.
Yeah. I waited to see if anyone else was going to say something first. I don't want to just keep grabbing the microphone. But I think the flexible delivery of allied health courses is really important because we have so many people that want to do courses, but just it's very, very hard. I had 4 young children when I did mine. There's no way I could have done my nutrition degree if it wasn't flexibly delivered. So, it's just hard, especially when you look at the rate of middle-aged women. So a lot of these would be mums, we assume. So, I think that the more flexible delivery we can get, we'll get a lot more people, Aboriginal, Torres Strait Islander people, coming into allied health courses.
Yep, agree. Thanks, Nikki.
Dawn? Over
there. The course that you talked about, the language...
Speech pathology.
The speech pathology. Do students get supported to come to Canberra for the... is it a block release type program, is it, or...?
Students are in all sorts of places and situations. Some of them are supported by their employers, others are doing it on their own. And the university certainly helps with accommodation for students when they come into Canberra. Yeah, so different kinds of support, I guess, depending on people's needs.
Right, and are the students in employment already, are they, or are they not?
Not all of them. I think probably our demographic is mums. Right. Mostly at home, often who've had children with hearing problems or speech and language problems and who are interested in learning more about that and taking a professional degree.
Do they get supported by AB Study?
Yeah, they do.
They could, yes,
Okay.
in the Aboriginal Torres Strait Islander.
Excellent, thank you.
Hi, Amanda from the ANU. Couple of, I guess, their comments, and I think Nicole kind of either touched on them or IHA is probably doing a lot of work around it already, but advertising of allied health degrees, conversations that I have had with some medical students in a research project I did in my master's was that they'd never even heard of public health nutrition or nutrition as an avenue, whereas medicine is heavily advertised to Aboriginal and Torres Strait Islander people. So again, I know they've got on the IHA website great resources around showcasing their Aboriginal students, and I think that's something that was previously lacking and maybe isn't available to all people who are looking at health degrees. The other thing I found in my research was that academics within the university, including, sadly, people who worked within the Aboriginal support centres, weren't aware of bridging subjects, so that students who perhaps graduated from high school without the academic prerequisites for a course didn't even know that the university offered bridging subjects for students to access allied health courses. So I guess there were, just 2 things I noted that you missed in kind of barriers for students even accessing university.
Yeah. So general awareness about allied health career paths and ways in. Yeah. Yeah, and I think that's right. I think medicine's had a high profile for a long time, and often we see more students in physiotherapy, for example, because it's well known with the relationship with sport. But we really need Aboriginal and Torres Strait Islander occupational therapists, speech pathologists, podiatrists. Yeah.
Everyone.
All of them.
All of the above, yeah. And I think if you're in a major centre like Canberra, the education assistants in the school system can provide that sort of advice. But if you're outside of Canberra, then it's just not available. And many of our kids come from, well, the Canberra catchment is from the south coast right up to, mid New South Wales. So it's increasingly more difficult in that area. But I know that within Poche Sydney, a lot of the support we got was for dental assistance was out of the Rotary Club, and they were very keen to provide scholarships to help students get through, and there are other service organisations that are keen to do it. So it's just a matter of how do you mobilise and get them involved. And I think part of that, and what we try to do, is to continually profile the sort of work that we do and the opportunities that are available, so that people can aspire. And we talked about this morning, if you were there this morning, I talked about quite a number of the Poche centres who run programs for youth and even from primary school to start to expose them to universities and other programs, so that they can see that there are Aboriginal professionals out there, across a whole range of disciplines, and so they have something to aspire to. But we need to do a lot more of that, and I guess that's where IHAR and Indigenous doctors and these other bodies are able to really demonstrate that we have some very highly qualified medical practitioners out there, or allied health practitioners. Lenny,
Me again. I think we need more social workers. We talk about suicides and preventions, and we're talking about mental health and stuff like that. I'm one of 100 in my class doing masters in social work, and I feel really out of place sitting in my classroom. One person, Aboriginal person. But I think we need to get social workers out there in our communities to work alongside as our young people. Because a lot of our young people don't go and talk to social workers because of that cultural barrier and stuff. So I think, yes, great to be a doctor, great to be a nurse, physios, whatever, but to me, we're talking here about mental health and we're talking about suicide prevention. There's the first one we should be focusing on, getting more Aboriginal social workers out there into the communities, working alongside you guys.
Thanks.
I'm Corrie Williams. I'm here for Speech Pathology Australia. It'd be good if I could say it, wouldn't it?
You were just testing us.
So this question is for Michelle or Nicole. I'd be interested to hear how you think our National Association could increase the profile of our profession for Aboriginal people.
Do you want to go?
We're doing work with associations, particularly. Sorry. We're doing work, IHAR's doing work with speech pathology, especially around our cultural responsiveness. So that's a good start and commitment from a few associations around the country, Speech, OTs, another one, looking at cultural responsiveness and how we can all work together. So I think that's the start, looking at that, and then the rest would just come, I think. But having that partnership and connection already, and having frank discussions about what we think the associations, and I'm sure Donna, our CEO, has these very interesting discussions, what the associations should be doing in getting more Aboriginal and Torres Strait Islander people into the professions. That helps, answers the question.
Okay. Before we go on,
Michelle.
do you want to go? No, well, all I was going to say was we were going to get each of the panel members to come up on here and have an open session with all the panel members, so you can fire the questions if Pat can stay awake. She had to come across from Perth, but poor thing. Yeah, so if we can just hold questions up till then and get the panel up. Paul, Pat, Nick, come on up. Michelle.
Thank you.
And thank you, Michelle, for your great presentation.